Hello guys, this is Dr. Asif. Today I'm going to make a new video about the short case discussions that you have been seeing my other short cases which has been developed and recently been uploaded to the YouTube. So for that continuations, today I'm going to discuss about sebaceous cyst, which is very common subcutaneous soft tissue swelling, and which is invariably given to the exam. So as a short case you have to complete the whole process within 5 to 7 minutes. So if you want to compete in the exam, because in case of MCPS and FCPS exam you have to see 3 or 4 short cases within 30 minutes. That's why it's very important to complete it with full potential. Thank you. So let's start our session. So first you have to make a rapport with your patients as a doctor-patient relationship. That is, Assalamu alaikum, I'm Dr. Asif Nawaz, MCPS and FCPS final, whatever it is, examining. I will discuss with you about your disease and I will examine you. So you will get not hurt. Sir, I need screening and attendant and ensure sanitizations by your pocket by small sanitation device. And some question you need to ask, that what is your problem, and the patient will show his problem and how many days you are suffering from, and has it grown slowly or quickly, is there any other pain present or not, and is there any similar swelling in any other part of the body. Like, we need to know, is there any synchronous lesion present or not. Okay, let's see. You are seeing that the patient has a small swelling in his arm, just above below the elbow. I think it's a left-sided arm. So you are seeing this is a soft tissue swelling present in the upper and lateral surface of the elbow arm. So what are the examinations points? So examination including inspection and palpation. So inspection point is a side flexor surface of the right forearm, and the size, shape and overlying skin is normal. And the palpation, in the temperature normal, tenderness non-tender, size, shape, surface is smooth, and margin is well defined, consistency cystic and tensely cystic sometimes, and the fluctuate but not transilluminant, not pulsatile, not compressible, and swelling itself is indented, and fixity is the overlying skin cannot lift up, and free from underlying muscles. So here you can see one thing which is different or slightly different from lipoma, that is overlying skin. It cannot be lifted because skin is involved with the swelling, and free from underlying structures, it is same as lipoma. Okay, now you have to present after examinations within 2 to 3 minutes. You have to explain what you have found, that there is a swelling in the flexor aspect of the surface of the right forearm, which is spherical in shape, measuring about 2 into 3 centimeter. There is a punctum over the swelling. Yes, this point you should remember. The punctum, that means a point which is one kind of opening. Okay, so punctum should be present in case of sebaceous cyst, but in the lipoma there is no punctum like this. Okay, so temperature is normal and the swelling is non-tender, surface is smooth and well defined, and cystic in consistency and tensely cystic, sometimes fluctuant but not transilluminate, not compressible, not pulsatile, not reducible, but the swelling itself is indented and overlying skin cannot lift up, but it is free from underlying structures. Okay, very simple. What you have found, just explain that things. So now your teacher will ask you some question within 2 to 3 minutes, within 1 to 2 minutes also, that what is your diagnosis. My diagnosis is a sebaceous cyst on the flexor aspect of the right forearm. Why it is sebaceous cyst? So cystic inconsistency is the first point, and skin is fixed in the central part of the punctum, and which is bluish or a blackish in spot. And why it is not dermoid cyst? Why it is not dermoid? overlying skin is not free, and punctum is present, not present at birth, right? Okay, so you can see punctum is the fundamental points in case of sebaceous cyst, and which is unique, and that is not present in case of dermoid or lipoma. Okay, so your next question should be, what is your plan? So what we will do in that case? So after thorough evaluation and proper counseling of the patients, I will advise surgery, okay, and the excision of the cyst either by dissection or by incision and avulsion of the cyst. What I have seen, excision of the cyst either by dissection or by incision and avulsion of the cyst wall. And what is dissection method? The elliptical incision is made on the skin entering the punctum, and then the cyst and overlying skin is gradually dissected, and the surrounding skin and subcutaneous tissue till the entire cyst can be removed intact, and otherwise recurrence is inevitable. Okay, so you have to take whole capsule, because it is a capsulated swelling, it has a infected capsule or a capsule containing some cheesy material, so you have to remove whole materials along with the capsule. If any part of the capsule is left inside, in that case recurrence is inevitable. An avulsion method is the incision is made through the skin over the cyst, and the cyst containing them squeezed out, then the cyst wall is held with a pair of dressing forceps and carefully avulsed, dissecting. When sebaceous is infected, preoperative antibiotics should be started. When the infection subsides, the excision of the cyst is performed. If the infection does not subside, the cyst should be incised, and the pus and semi-liquid or cheesy materials or fotid materials are expelled out. This is followed by dissection or avulsion of the cyst wall. This method is not used, but it is used when there is dissection method is failed, because patient in sebaceous cyst sometimes become infected, like the patient with diabetes, he has very prone to infected sebaceous cyst in the back or other region. In that case, the surrounding structure is more adherent with the capsule, and pus or infected edematous tissue are present surrounding the infected sebaceous cyst. In that case, some portion of wall should be left out. In that case, we will use avulsion methods. We'll squeeze out the materials, and then we just make a bigger incision and just try to find out the capsules and remove it. Okay, so what are the features of scalp sebaceous cyst? It's an extra question, it will not be asked, but you should know. The swelling is free from underlying structures. Sebaceous cyst moves with movement of the scalp, and the no punctum is usually visible. Usually loss of hair is noted over the swelling, and the skin is attached to the swelling, and no impulse on straining or coughing. No bony indentation can be felt, but the swelling itself can be indented by the fingertip pressure, and this is diagnostic. Okay, so what are the complications of sebaceous cyst? Infection or suppuration, ulceration, calcification, and sometimes sebaceous horn. If you see Bailey Love's surgery book, you will see a patient, a female, which containing the sebaceous horn in her forehead. That is nothing but a sebaceous horn, right? Okay, and it is rarely malignancy, rarely become malignant. Also you can see the non-malignant lesion, but sometimes basal cell carcinoma can be happen from long-term sebaceous cyst or repeated infection or any other factors which may cause it as a malignant lesion later on. What is the most common complication after operation? Incomplete removal of the cyst, and wall may lead to recurrence. Dermoid and sebaceous cyst both containing cheesy materials. Is there any difference histologically in their lining wall? Yes, it's a very important question. In dermoid, wall containing sweat gland, hair follicles, papillary layers of the skin. That means all three germ layer derivatives. ectodermal, endodermal and mesodermal derivatives can be found within the dermoid cyst. And yeah, but in case of sebaceous cyst, this kind of things not been found, rather than cheesy materials. Sometimes, rarely, wall of sebaceous cyst contain a minor worm called Demodex follicular. I didn't hear it about anyone. It's a rare things, but in our country, but in our subcontinent, I think it's rare things. Rarely happens. Okay, thank you. That is all about sebaceous cyst. So it's very cool and common swelling. When you see these kind of things, you just diagnose it and do accordingly, and I think it will be very helpful for you for the post graduation examinations. Thank you very much. Fees, and keep like and subscribe my channels, and also give encouragement for future video making. Thank you.